رمضان كريم and كل سنة وانتو سالمين. I would like to thank you all for attending today's session, and I would like to thank London Muslim Mosque for hosting and organizing this session. We are here today because we recognize the challenges that faces people with chronic diseases, especially diabetes and cardiovascular disease. They face a lot of challenges if they decide to fast. We have a panel of experts with us today, Dr. Khan, Dr. Abdu, and we have our lovely dietitian. We put her on the spot today to participate in this event. And of course, we have our Shaykh, Mohamed Al-Jammali, who's going to address the religious aspects of fasting for people with chronic diseases. We are hoping to shed some light onto those challenges and guide and help you make decisions to fast, hopefully safely this Ramadan. So we'll start off with Shaykh Mohamed Al-Jammali.
السلام عليكم ورحمة الله. بسم الله والحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه ومن والاه. اللهم اجعل جمعنا هذا جمعا مرحوما وتفرقنا من بعد تفرقا ساميا معصوما. اللهم لا تجعل فينا الشقية ولا محروما ولا مطرودا ولا معذبا بنار برحمتك يا عزيز غفار. First of all, on your behalf, would like to thank our guest speakers that they came despite their busy schedule to educate the community about important subject. And may Allah subhanahu wa ta'ala put that in their record of hasanat. And it's very important, actually, we go to consult the people of knowledge. As Allah subhanahu wa ta'ala said, فَاسْأَلُوا أَهْلَ الذِّكْرِ إِن كُنْتُمْ لَا تَعْلَمُونَ. Ask the people of knowledge if you didn't know. Which important. That's if somebody asks me a fiqh question, but it's related to a medical aspect, then I will tell them, you might, in this asking the wrong person. So always, we go ask the people of knowledge in this. We have the general rules, but not always the general rules apply to everybody. And sometimes the matters is a case by case, like, where this person will be permissible, the other person is not permissible. The same action for X, it might not, be the same for Y or Z a person. They said in Arabic, ما يصلح لزيد قد لا يصلح لعمر. What can fit with this person might not fit for others. So that's why here to address all of that, we're going to talk generally about, what you should do. However, you know yourself and you know your case. So we are hoping at the end that we listen from you, your question, your concern, and hear your time that, to benefit yourself in Allah subhanahu wa ta'ala. There's no doubt fasting actually bringing a lot, health aspect as we know. And there are many ahadith about the benefit of fasting for our body. And this maybe is not the time to come, across all of that, but I'm sure you experience yourself. And many times you visit a doctor, he will ask you to do that. And nowadays, there's many trends about, the fasting and different, style of that. And subhanAllah, that's to confirm what Abu Asalam said in multiple ahadith about the benefit of fasting for our health. But here, it is important to practice your deen as important to safeguard your life, And if, you want to practice your deen, but then that you cause harm for yourself, that means you are not understanding your deen in the right way. So some people, they might fast seeking the reward, but actually they are sinful in this. If that cause damage for them or abnormal hardship. Fasting attached with the hardship, but we're not talking about that a normal situation. But if it really causes damage for you and your health, you might, actually not gain a reward in this. So you have to understand this. There are some people, they insist to fast despite the advice of all their Muslim doctors, and they advise them not to fast because that might, increase the illness or delay, the cure. So in those people, they have to understand that that's ibadah, act of worship, do and don't. So not only just do. Sometimes when you are healthy and you are fit, that's your ibadah, to fast. But in some times where you are not fit for that, your ibadah not to fast. Because you are he's the one, he gives you the permission not to fast. He's the same one who commanded you to fast. So we have to understand this. However, do not take it lightly. Some people say, oh, I am diabetic. And they use that as excuse for them not to fast. That's not right. So we have to be reasonable and to be, having clear understanding. And the doctor will tell you that doesn't mean like every diabetes, case that, he should break the fast. No, actually, some of them, it's better for them to fast. But how you manage, how you adjust your medication, how you're going to eat, how you manage, through the hours of fasting, and what you should do in the minimum hours of breaking the fast, because, we have a short night. So he will tell you how to manage and how to do. But do not take it just for granted, I'm having that condition, then I should, break my fast. And they use some hadith in the wrong context. They said, "Istafti nafsak wa in aftaka an-nas yaftawk." Ask yourself, even if people give you a fatwa. No, this is not the point. So we have to make sure we fulfill our duties as Muslims, but at the same time, if we have permission and that apply to us, we should not hesitate to come forward to apply this. And subhanallah, I will end with this point. It's our deen, our religion is beautiful. If somebody was not able to fast because of health condition, he would be granted the reward as if he fasted. As mentioned in the hadith, if somebody, he used to do such and such act of worship, because of his health condition, he stopped doing that, he will still be rewarded as if he was doing it as the time he was healthy. And if somebody like traveling, and he used to do such and such act of worship, but because of his traveling, he couldn't do it, he will still be rewarded as if he was doing it as the time he was not traveling. And that's in the hadith of the Prophet ﷺ. So we have to understand this. You all might just, having the permission to break your fast, and still even be rewarded as if you fasted. So do not have to worry about this. You ask, what's good for me? That's your question. What's good for me? Is it for me in my condition? Is it better to fast or not? How I should manage if I want to fast? And that's inshallah the main questions for our tonight's session. And may Allah subhanahu wa ta'ala enable us to practice our deen in the way that pleases Him subhanahu wa ta'ala. Ameen.
Thank you very much, Shaykh Mohamed. Next, I would like to introduce Dr. Khan. Probably some of you know him already from the community. He's an associate professor at University of Western Ontario. He's an internist and an endocrinologist who works at the London Health Science Centre and St. Joe's. Dr. Khan has an interest in diabetes management, and he would address the risks that attached with fasting for diabetics in Ramadan, and he will help us find some strategies how to mitigate those risks during the fast. Dr. Khan.
Thank you very much, Dr. Bakir. Assalamu alaikum to all of you. I am very grateful to the management for organizing this and for inviting me to talk about this subject, which has been close to my heart, and we've been working on this for the past several years. This is not specific advice. This is just some advice to provide strategies as to how to fast safely during Ramadan. So, there are no disclosures that are relevant to this presentation. I have been one of the authors on the position statement that we came out with from Diabetes Canada that could help people fast during Ramadan with diabetes. And then more recently in 2021, we presented the Diabetes and Ramadan practical guidelines as well. So I was one of the authors on those two statements. The agenda is relatively simple. We'll talk about the scope of the issue, as to why we're talking about it, some of the risks, strategies to mitigate these risks, situations in which the fast need to be broken, and finally, I'll touch upon some of the medical benefits of fasting as well. So why is this important? Diabetes is highly prevalent worldwide, but it is more prevalent in Muslim majority countries. Now, this is not an all-inclusive map. However, in Muslim majority countries, the prevalence of diabetes is roughly twice that here in Canada. So over here, roughly speaking, about 6% of Canadians do have diabetes. In some of the Muslim majority countries, I derive my heritage from Pakistan. The prevalence rates are around 13%. Saudi Arabia, some estimates suggest that it could be up to 25%. So, the prevalence of the disease condition is much more pronounced in our communities compared to the general population here in Canada. So that is one of the reasons why it is important to talk about it. And among those who do have diabetes, so there's essentially two types of diabetes. So there's type 2 diabetes, which is much more prevalent. About 90% of us, do have type 2 diabetes, where the body cannot make use of the insulin that it's producing. So out of those who have type 2 diabetes, roughly around 80% tend to fast for at least 15 days of the month. Then there is type 1 diabetes, where it usually is seen in people that are younger, and rather than inability to make use of insulin, it is characterized by absence of insulin or deficiency of insulin, essentially. So these patients need insulin multiple times during the day. And even among those, about 40% of them do fast for at least 15 days during Ramadan. So, it is more prevalent, and among those that have these conditions, a lot of them do tend to fast. So that is the reason why we're talking about it, because it does bring with it several risks. So there is risks associated with hyperglycemia. When sugars go too high, they can cause problems. They can cause dehydration. They can cause, if they go untreated, they can cause people to present to the hospital in conditions like diabetic ketoacidosis, where your body starts making use of fat as fuel rather than glucose as fuel. And that produces toxic byproducts. So it can lead to medical emergencies. On the flip side, patients are at risk of low sugar episodes or hypoglycemia as well. So particularly those that are taking insulin or medications that could cause sugars to go down too low. Along with that, I mentioned there's risk of diabetic emergencies, and then there's also risk of dehydration as well. So that's the reason why it is important to talk about it. And as Shaykh was mentioning, it's easy to sort of paint everything with one brush. However, the vast majority of patients with diabetes are able to fast during Ramadan. However, patients who've had risk factors for these conditions, or patients who have had a history of low sugar episodes or really high sugars, those are the ones, where we need to be cautious about their ability to fast safely during Ramadan. So, in the latest iteration of the guidelines, we came up with sort of a risk stratification tool to identify those individuals that are at high risk of having these complications. I'm sorry that this is a busy slide, but I just wanted to bring home the point that patients, that are at high risk of developing these conditions, for instance, those with type 1 diabetes are at a higher risk. Those who've had diabetes for a longer duration are at a higher risk. Those who don't have good glucose control prior to the start of Ramadan are at high risk of having complications. Those that are receiving insulin or medications that can cause sugars to go down too low. We'll talk about some of them, have a higher risk compared to others. Pregnant ladies, so they are at high risk as well. So essentially, this categorizes people into 3 different streams. So those that are at low risk of complications, so those with scores of 3 or less on this, based on this table, should be able to fast with medical guidance. Those whose scores are 3.5 to 6, are at moderate risk, and they are advised not to fast. So for instance, if somebody is pregnant, their score is 3.5, so they would be advised to not fast. And those who score more than 6 are at very high risk of these complications, and they should not fast. Having said that, there are people that are even in the highest risk category that do decide on fasting. So we do provide some guidance as to how to mitigate those risks during Ramadan. So the first step in mitigation of risks is to make sure that we take stock of our sugar control. So in this slide, basically this shows how our sugar levels change during the course of the fasting hours. So this red line is during Ramadan, and the blue line represents sugar levels outside of Ramadan. So as you notice, so there is a bit of a spike at suhoor time, and then glucose levels continue to go down low, and they are at their lowest just before iftar. So there is a common misconception, or there used to be a common misconception, that checking sugars basically invalidates the fast. That is not true. So I'm not an expert on jurisprudence, but we've had advice from experts, and checking blood sugars during Ramadan does not invalidate the fast. If anything, checking sugars during Ramadan makes it more likely for people to be able to fast safely compared to those who do not check their blood sugars during Ramadan. Now we have continuous glucose monitors. You can basically put them on your arm or on the belly, and they can monitor sugars 24 hours of the day, and that too does not invalidate the fast. But for those who do not have access to those devices, it is important to check your sugars, and if there is one time that you would pick to check your sugars, that would be immediately prior to iftar, to make sure that you're not going low. In case sugars are going too low, it can cause significant medical problems. Some of them can be irreversible. People can, it can impair memory. People can have cognitive problems down the road. So those people that are having low sugar episodes, and by low I mean less than 4 or so, it is important for them to make dietary changes, and if those low sugar episodes still persist, it's important for them not to fast during Ramadan. And subsequently, as you notice, after iftar, there is a surge of sugars, and you are more likely to have really high sugars after iftar. So it is important to maintain a balance in the meals and make sure that we're not having too many carbohydrates, so that we're not seeing these highs after iftar. So this slide essentially talks about what builds upon what I was talking about before, that checking blood sugars also has to be individualized. In somebody who is not taking insulin or medications that can cause sugars to go down too low, you can check once or twice a day. In somebody who's taking insulin multiple times of the day, it's important to check at least close to 5 times during the day to make sure that we're not having those highs or lows, because insulin can drop sugars, and these patients can have really high sugars after suhoor and iftar. And our targets generally are around 5.5 to 7.5 for before the meals for those who are taking insulin. I'll leave dietary advice to our expert Minna here, but here's an example of what a healthy plate looks like. There has been a tendency to not have green leafy vegetables or salads during Ramadan, but roughly like half of our plate should comprise lentils and salads as well, so that we are limiting the amount of carbohydrates, and the rest you can have a source of protein and a source of carbohydrate, And that is sort of a balanced meal. And this should be taken not just during Ramadan, but after Ramadan as well. We like to have dates, it is part of Sunnah, but part of Sunnah is also to consume things in moderation. So, if you're having a large date, one large date would be enough. If you're having smaller dates, perhaps a couple are fine. But, if you're having 3 or 4 large dates, they will cause your sugars to go up. And the amount of carbohydrates, I think Mina will allude to this in more detail, could be close to the amount of carbohydrates that we are allowed for an entire meal if you were to have like 3 or 4 large dates. So it is important to consume, these in moderation. So this is, the typical iftar, that we would typically have, but this is sort of an example of a balanced iftar meal to make sure that, our sugars do not spike after the meal. In terms of physical activity, for those that that do have diabetes, it is moderate physical activity is okay, but rigorous physical activity, because not only could it cause your sugars to go low, it would also cause people to become dehydrated. So it is best avoided to do it before iftar, when you are at most risk of having a low sugar episode and most at risk for having dehydration symptoms as well. After suhoor, one can partake in modest physical activity. Tarawih prayers, in addition to their benefits spiritually and from a religious aspect, could be considered a physical activity as well. In terms of, this is sort of the last section. In terms of medications, most medications, or several medications, should I say, do not require any adjustments. The exceptions include medications that cause sugars to go down too low. So, there is sulfonylureas. So, gliclazide or diamicron is one that is used. There's an older one, glyburide. They can cause sugars to go down too low. If possible, we have suggested that they are changed to a different class that don't cause low sugar episodes. If you do need to take it, gliclazide can be used. We suggest avoiding glyburide because it is associated with, it is more strongly associated with low sugar episodes. There's other medications, you may have seen commercials on them, so injectable medicines, you inject once a week, they cause your sugars to get better, but also cause weight loss, one of them being semaglutide or Ozempic. While they themselves don't cause sugars to go too low, however, they can be associated with nausea, and vomiting basically invalidates the fast. So because of that risk, we suggest that if they are started, it is important to reach the maximum dose about 2 to 4 weeks prior to Ramadan, because those side effects are associated with the dose that you take for the medicine. Similarly, there are medications, Jardiance or Forxiga, Invokana, that are SGLT2 inhibitors. They are excellent medicines to protect the kidney, to protect the heart, but they can cause some dehydration as well. So particularly during the summer months when fasting hours can be about 16 hours or so, people can be at risk of dehydration. So it's important they're ideally started about 2 to 4 weeks prior, so that you've gotten used to it and it is less likely for you to have to experience dehydration. In terms of insulins, roughly we suggest reducing about 15 to 30% if you're taking them once a day. And if you're taking them twice a day, you can take the usual dose at iftar, but reduce by about 50% at suhoor. In terms of short-acting insulin, since it is only taken when you eat, so therefore you would only take it twice a day, once at suhoor and once at iftar. And since iftar meals, if anything, have large amount of carbohydrates, take the normal dose at iftar and reduce suhoor dose by 25 to 50%. Finally, when to break the fast, anything in terms of diabetes, if sugars are too high or too low, so by too low, if they are less than 4, too high, higher than 16, 16 and a half or so, or if you have another medical condition that requires you to break the fast. So those are conditions where the fast should be broken. Finally, in terms of medical benefits, so Ramadan is about, self-restraint and discipline. So studies have shown us that those who exercise self-restraint, who participate in structured programs, monitor their sugars, do have net weight loss as a result of fasting during Ramadan. If anything, they have a reduction in low sugar episodes, and some of these improvements can sustain up to about a year post-Ramadan as well. So in addition to reaping the spiritual rewards of Ramadan, exercising this restraint and participating in monitoring your sugars can have long-term benefits for one's health as well. I am, very grateful to you for all the attention, but basically fasting poses unique challenges, and through risk mitigation we can reduce the risk of these challenges. And if we were to follow the true spirit of Ramadan, that is to exercise self-restraint, it can lead to medical benefits in addition to the spiritual benefits that it offers. I'm very grateful to you for your attention, and at the end we'll have some time for questions.
Thank you very much, Dr. Khan. This was very informative, and now we'll introduce Yumna, Minna, our dietitian, for a quick review of diet management in Ramadan. Minna, she's a registered dietitian. She works in long-term care, and she has an interest in diabetes as well.
Hello, everyone. Thank you so much for having me today. I wasn't actually expecting to talk today, but hopefully I want to provide you with some knowledge regarding the types of foods that you should be focusing on when, during Ramadan, and also helping manage your blood sugars. So a lot of the clients I see have diabetes, and part of my role as a dietitian is educating them on what foods to eat. So before I got started, I just wanted to kind of go over some important things. So there's, have you guys heard of macronutrients before? So basically what they are carbohydrates, protein, and fat. So the one that affects usually your blood sugars are the carbohydrates. And basically what they are is like your grains, so your bread, your pasta, your rice. Those usually raise your blood sugars. But also anything that has sugar in it can definitely have an effect on your blood sugar. So it's really important to watch what you're eating. In terms of protein does not raise any blood sugars. And examples of protein could be from animals or plants. Examples of animal-based protein could be your meats, your chicken, your turkey. So typically those don't raise your blood sugars, and it's okay. Like, it's very important to have protein because it's very important for your muscles. And then some examples of plant-based protein could be, your legumes, your lentils, your beans. So those, again, provide a good source of protein, and they don't raise your blood sugars. And then the third thing is fat. So I'm not going to delve into fat that much because there's two different types of fats, the bad fat and the good fat. So as long as you're choosing things that are like olive oil or canola oil, those are usually considered the good types of fats. And again, like Dr. Khan said, it's very important to include these foods, but also make sure that they are consumed in moderation. So the focus is, so basically during Ramadan, it's when you break your fast. As per Canada's food guide, they recommend to have half of your plate filled with vegetables. and then which leaves the other two, the other half of the plate. One quarter would be the protein, and then the other quarter would be your carbs. So, so the carbs, again, the choice of carbs is very important. As a dietitian, I usually recommend things that are higher in fiber, because fiber is known to help with controlling blood sugar levels, and helps you feel full for a longer time. So it's important, the choice of carbohydrates. So the ones that are usually high in fiber are usually brown in color. So like your brown rice, your whole grain bread, your whole grain spaghetti, whole grain pasta, and then that would be important to include as part of your meal. But also portion sizes are important, and this is based on the individual, and moderation again is important, I think. So again, the goal is to make sure you're having a balanced meal and incorporating these three food groups. So the protein again, which is very important for the muscles, carbohydrates, with the focus on whole grains, and then your vegetables. And I know sometimes when we break our fast, we tend to be thirsty, obviously, because we haven't had anything to drink or eat the whole day. So the choice of drink is, water is the best choice of drink. So any of those juices, they likely are high in sugar, and they can contribute to high blood sugars. So it's very important to make sure you're well hydrated during Ramadan, and also kind of watch, because the majority of the drinks like karkade or I don't know, other things, Amr ad-Din, they're typically very high in sugar, right? So, so that's very important to keep an eye on. And again, there's a lot of things that we indulge in Ramadan that are very high in sugar, like the sweets. So again, like the baklawa or atayef. These they are high in sugar, obviously, right? So maybe substituting them with something that's healthier, like fruits. Again, I don't want to go like deeper into this because I don't want to overwhelm you with too much information, but there are some things like fruits that are higher on the glycemic index, meaning that they can potentially raise your blood sugars more than other fruits. So a glycemic index is basically, it rates basically which, like from low to medium to high, what foods can cause your blood sugars to go high. So obviously you'd want to avoid the ones that are on the high glycemic index category. So I wish I had a visual to show you an example, but the one that really comes to mind is watermelon. It's very high in sugar. So again, just making sure that you are having these things in moderation. What else? Do you have any questions?
We'll leave for the question later.
Okay, there's questions at the end. So I'll pass it off to Dr.
Thank you.
Thank you, Minna, for this great presentation. We put her on the spot today. She wasn't prepared at all for this. So I think she passed. She did a very good job today. Next, I will introduce Dr. Majdi Abdu. Dr. Abdu, he's an internist and cardiologist as well. He's a fellow of the Royal College of Edinburgh in UK, and he's a fellow of the the American Cardiology Association.
Yeah.
Dr. Abdu.
Bismillah ar-Rahman ar-Rahim. Okay. Assalamu alaikum. First of all, I would like to thank London Muslim Mosque for inviting me to have my presentation before Ramadan. And it's an honor for me to serve the Muslim community in London. My presentation will be about Ramadan and cardiac patients. We'll take our commands from Quran. في سورة البقرة بسم الله الرحمن الرحيم شهر رمضان الذي أنزل فيه القرآن هدى للناس وبينات من الهدى والفرقان فمن شهد منكم الشهر فليصم ومن كان مريضا أو على سفر فعدة من أيام أخر يريد الله بكم اليسر ولا يريد بكم العسر ولتكملوا العدة ولتكبروا الله على ما هداكم ولعلكم تشكرون. In English, so whoever is present this month, let them fast, but whoever is ill or on a journey, then let them fast an equal number of days after Ramadan. Allah intends ease for you, not hardship. And to the end of the verse. So we take our commands from Quran. We are, as healthcare professionals, make recommendations and advice to our patients, but our highest reference is Quran. And there is no conflict between Quran and our recommendations. My agenda it's a busy agenda. I hope I can finish before Isha prayer. I will talk about the risk factors for cardiac disease. Then I will move to stable coronary artery disease and unstable cardiac patients, heart failure patients in Ramadan, arrhythmia, rhythm abnormalities, either from the atria or from the ventricles, hypoglycemia risk in diabetics, and Dr. Khan elaborate the subject very beautifully. Physical activities, also Dr. Khan give highlights about the intensity and the timing. And what about cardiac medications in Ramadan? How can we tailor the cardiac medication? And by the end, the take-home message. There is a general recommendation for patients with cardiovascular disease, patients with cardiac conditions desiring to fast in Ramadan should be assessed on an individual basis. And Shaykh Mohamed elaborated this beautifully. We have to assess each patient on an individual basis. And this is the new medicine. There is general outlines, and there is individual close-up assessment for this certain patients. All patients who are fasting should be educated. This is part of the assessment before Ramadan on their risk and management, including risk of dehydration, fluid overload, and they have to terminate the fast if they become unwell. And all this will be reviewed after Ramadan. This is a quite busy slide, but actually it's the most comprehensive consensus report about cardiac disease in Ramadan, how to manage, how to assess your patients. This is by the Turkish Society of Cardiology Consensus Report 2021. So it's almost like 1 year. I would like you to just to look for the hearts we have three hearts, three different colors, the green heart and the red heart, and in the middle, the yellow heart. The green heart, this means in one direction, the patient can fast safely. And also we can say fasting is good for some patients with regard to like risk factors. The red one means fasting is not advised and should not be advised to some patients. The yellow in between, they can fast with close monitoring. As I mentioned, risk factors for heart disease, we know the risk factors like high blood pressure, lipid abnormalities, cholesterol, smoking, diabetes, stress, obesity. This is an example for some of the work by Muslim doctors and published in Journal of the American Heart Association, 2021. One of the studies, it's Lawrence study, London Ramadan study. It's conducted in Turkey also. The number of patients is not huge number of patients, but the beauty in this study, they found the hypertensive patients benefit from fasting with reduction of systolic blood pressure on average 7.29 and diastolic on average 3.42. I have to remind you, this patient, they are middle-aged and the majority are healthy. If we go to the other slide, there is a huge number of studies conducted. We take out of them 33 studies, and we make a meta-analysis of these 33 studies, which includes more than 3,200 patients, and they found this patient benefit from fasting with reduction of the blood pressure, systolic 3.19 and diastolic 2.26. So, by conclusion, hypertensive patients benefit from fasting during Ramadan. And there is a hypertensive patient, we have to advise them to fast during Ramadan. No exemption except in one situation, the patient with severe uncontrolled hypertension. This category of patients may suffer from coagulation problems during prolonged fasting. So this category not advised to fast. Also, if the patient taking large doses of diuretics, we have to reassess them, and if we can regulate the dose of diuretic, they can fast safely. We'll come to another study about the effect of fasting on the cardiovascular risk factors. This is an observational study published in the Nutrition Journal in 2012. I will go direct to the conclusion of this study. The study shows significant improvement in 10-year coronary artery disease risk score. We have score for the risk of coronary artery disease. We call it the Framingham risk score. This score, like a calculator, you put the data of the patients, and then you assess the risk of coronary artery disease, acute myocardial infarction or myocardial insult within the next 10 years. And they found from this study that the risk decrease after fasting with follow-up of these patients by around, as you see here, from 13 plus minus 8 to 10.8 plus minus 7. Any reduction in the risk score is very good for the patient with multiple risk factors. This is this decrease in the risk score was due to decrease the bad cholesterol, increase the good cholesterol, decrease triglycerides, decrease body mass index, systolic blood pressure, waist circumference. All these are parameters of risk. So when they improve, they bring down the risk score with significant result. Now I will come the Turkish consensus study. We'll talk now about hypertension. As I told you, we have 3 hearts, green, yellow, and red. For hypertension, patients can fast safely, provided there is a pre-Ramadan consultation with their physician to make tailoring of their medication. Try to, if they have 3 times the medication, you can try to bring it down into 2 or even 1 medication with more than component in the tablet. We know most of the hypertension medications are long-acting medication. So this can be achieved through counseling with the physician. Also, patient should adhere to strict diet with low salt and not to forget their medicines. What about the patients in the yellow zone? Patients in the yellow zone, they need just to make tailoring of their medicines. If they, as I mentioned, if they are taking medications twice daily, if we can bring it down into once daily, if we can replace the diuretic by another medicine without compromising the blood pressure, this is good. As I said, severe uncontrolled hypertension should not be advised to fast. The second consensus statement about cardiovascular prevention and cardiac disease. Now we'll go to type 2 diabetes, and Dr. Khan elaborate diabetes very well. So I will not focus on diabetes. Patient with coronary artery disease, with ischemic heart disease, should be evaluated, as I mentioned from the beginning, on individual basis. What about patient with chronic kidney disease, especially stage 4 and 5? And they have also coronary artery disease. This patient at risk of increased kidney injury and also increased coagulation. So we don't advise this category of patient to fast. Also, patient underwent coronary intervention like cardiac catheters with intervention, with stenting within the last 3 months should be discouraged, should avoid fasting because of the risk of stent thrombosis. Also, patient with recent acute coronary syndrome or acute myocardial infarction should not fast for 3 months until they stabilize. What about patients with also cardiac surgery or any post-operative cardiac operations? They should also wait for 3 months until the condition stabilizes. What about heart failure? First, we have to say heart failure, we have 4 stages or 4 classes of heart failure. According, I'm sorry for this medical term, we call it New York Heart Association classification. This classification, there is grade 1, 2, 3, 4.
أشهد أن لا
The patient
إله إلا الله أشهد أن لا إله إلا الله
okay.
أشهد أن محمدا رسول الله أشهد أن محمدا رسول الله حي على الصلاة حي على الصلاة حي على الفلاح حي على الفلاح الله أكبر الله أكبر لا إله إلا الله.
So for heart failure, we have 4 classes of heart failure. The class 1 and 2 and class 3 and 4. Class 1 and 2, they can fast safely with tailoring of their medications, and they have to be assessed before Ramadan. And class 3 under yellow can fast with close monitoring. Class 4 should not fast. What is the difference? Class 1, patient symptomatology, symptoms on extraordinary effort. Class 2, patient symptoms like shortness of breath, fatigue, and all this with ordinary effort. Class 3, symptoms with less than ordinary effort. Class 4, short of breath while resting. So this patient cannot experience fasting. I will leave the rest. Now, patient with arrhythmia abnormalities. We hear this patient has palpitation. So arrhythmia may come from the atria and may come from the ventricles. In general, patient with supraventricular from the atria above the level of the, if you can imagine the heart, if you above the level of the mitral and tricuspid valve, this patient can fast safely. Like patients, maybe the very common atrial fibrillation. The patient with irregular atrial activity, which is common, one of the commonest arrhythmia we see in our practice. Patient with ventricular arrhythmia can be studied case by case. And what about other patients under red? These patients with genetic disorders affecting the electricity of the heart should not advise too fast. Like patient with long QT syndrome, patient with Brugada syndrome, patient with hypertrophic heart, some kind of genetic disorder, and this is we see in young and athletes and may have sudden cardiac death. So, okay. Exercise in Ramadan, Dr. Khan elaborate the best timing for exercise. Cardiovascular drug therapy, if the patient, we decide the patient can fast, so we have to manage the medication in the way to help him to continue fasting. Other disorders, the valve disease and pulmonary hypertension, increased pulmonary artery pressure. Regarding valve disease, patient with mild to moderate valve lesions, they can fast with monitoring. Patient with severe pulmonary hypertension or severe valve, we advise them not to fast. This is the take-home message. We can't leave without take-home message. Yeah. I will just, questions after Asha. Okay? Oh, the take-home message?
Yeah, we can take
Okay. Take-home message, it's a summary of what I mentioned. Assessment before Ramadan is recommended for cardiac patients for safe fasting. Patient can benefit from fasting regarding the risk factors. Patient with chronic stable heart failure can fast safely. Patient with atrial arrhythmia can fast. Patient with mild to moderate valve disease, mild to moderate pulmonary hypertension can fast. Exercise is preferred after iftar. And thank you.
Inshallah, on your behalf, would like to thank all the specialists, and inshallah we're gonna break for Salatul Isha, and then we'll come back after inshallah. We'll start our session 9:20 bi'idhnillah subhanahu wa ta'ala. So please be here immediately after Salah, and after Salah we'll take your questions inshallah. And then sorry for you holding in after Salah inshallah, but if you can come that would be great. Jazakumullah khair.